Good morning. Thank you, Sages.
Sorry, Dr. Zhang. Use this to move forward and this to move back, okay?
Thank you. Author.
I want you to touch the microphone.
Okay. Author, nothing to disclose. My topic is gastric bypass procedure for type 2 diabetes with BMI less than 28. Surgical treatment for type 2 diabetes have demonstrated satisfactory clinic outcomes and surgical intervention on patients with severe BMI more than 35 have been accepted by medical society and in many countries. However, effectiveness of surgical treatment for type 2 diabetes patients with BMI less than 30, especially for less than 28, is still controversial. To evaluate Nengwei gastric bypass procedure for patients who suffer from type 2 diabetes with BMI less 28, 31 suffer from type 2 diabetes undergo laparoscopic Nengwei gastric bypass surgery was enrolled in Beijing Zhang Hospital in 2 years. FPG, HbA1, C-peptide, and fasting insulin, and GLP-1 of all patients were measured before and 8 months after surgery. The patients underwent gastric bypass surgery successfully. Among them, 7 patients have hypertriglyceridemia. The average BMI was 26.5. The patient's demographics is age and the during of the type 2 diabetes and the BMI. The changing of BMI is changing is before surgery and 1 month, 3 months, and 6 months. This is FPG changing. Also, is 1 and 6 months after surgery. This is a result of HbA1, and also is a decrease after surgery. This is changing C-peptide, also decrease after surgery in 1 month, 3 months, and 6 months. This change is fasting insulin, also decrease after surgery in 1, 3, and 6 months of surgery. This change is GLP-1 and increase in after surgery in 1 and 3 and 6 months. The outcome of 31 patients and 6 months after surgery, completely remission in 22 patients, and no remission in 2 patients. The changing of the hypertriglyceridemia is a little change. At 6 months after operation, no deficiency of nutrition and mineral were observed. Our study demonstrated that gastric bypass procedure is safe and effective as a treatment for patients with non-obesity type 2 diabetes mellitus. The operation can evaluate the GLP-1 level, decrease insulin insulin resistance and increase insulin sensitive so as to get better control of blood sugar. Meanwhile, gastric bypass can also significantly improve the complicated hypersugar of patients. Further study will larger samples and long-term follow-up are needed. Thank you very much.